Hello everyone, welcome to yet another roleplay card session from Tiju Sir Academy, and this is Aishwarya. Today I have here with me Anugraha. So welcome Anugraha.
Thank you.
So how are you doing?
I'm great.
I'm glad to hear that. So for today's roleplay, what topic that we had chosen?
So our setting is a clinic and our patient is a 51-year-old female. She had a lesion removed from her hand, which is a squamous cell carcinoma, and she have overly exposed to sunlight during her teens. She have now come to the clinic for stitch removal.
Exactly. So for today's roleplay that we have chosen for a squamous cell carcinoma scenario. So Anugraha, basically how many types of roleplays are there in OET?
There are 5 types of role plays.
Exactly. There are unknown cases there.
There is known cases.
Home visit is there.
There is without introduction.
And unknown to known scenarios are also there in OET speaking.
Yes.
So for today's roleplay, which category it belongs to?
From the context of the role play, we can say that it is an unknown to known case because the patient had undergone the surgery already and she is coming for the stitch removal.
So what you are trying to say is, before beginning the role play or the initial part of the role play has to be constructed in such a way that we need to identify or clarify or confirm the identity of the patient.
Yes, exactly.
Alright, so shall we go for the role play then?
Yes, sure.
So here begins our today's role play card. So good morning.
Good morning.
Make yourself comfortable.
Thank you, nurse.
Alright, so let me introduce myself first. My name is Aishwarya. I'm a nurse working here in this clinic. So how can I help you today?
Nurse, actually I'm here for stitch removal. I have recently undergone the surgery.
Alright, so if I'm not wrong, am I speaking to Miss Anugraha?
Yes, that's right.
Alright Anugraha, I got the information that you're coming here for the stitch removal. So we will be doing that. Before that, I would love to ask you, how are you feeling now?
I'm generally well and okay, nurse, but I'm really worried about my situation.
Alright.
Because the doctor had told me that I'm having a condition called a squamous cell carcinoma and it's another name given for skin cancer. As it is a cancer case, I'm really worried.
Alright, I can totally understand your situation. If I'm in your place, I'll be reacting in the same way because these kind of diagnosis makes us overwhelmed. So, but don't worry, I'll give you a detailed explanation regarding the situation and I hope that that will make you relax. So will that be okay for you?
Yes, definitely.
So Anugraha, squamous cell carcinoma is nothing but a type of skin cancer which is caused by sun exposure or due to ultraviolet radiation. And it is happening in our squamous cell, which makes the outer or middle layer of the skin. So are you able to follow me?
Yes, nurse, I understood what squamous cell carcinoma means, but still, I'm really worried. Is there a chance of recurrence in my case?
Alright, your question is very much understandable and it's reasonable as well. But I can reassure you in your situation is that the best treatment for this particular condition is surgical removal. And in your case, you already underwent the surgery, which means you don't need to worry at all. So in your case, the chances of reoccurrence is highly uncommon.
Oh, that's great to hear, nurse.
Yeah, I'm glad that you're happy with that. So, but at the same time, please keep it in your mind, regular monitoring is very much important for your situation. It's important for you to keep on checking your skin for any new signs of spots or changes, and a doctor's regular checkup is highly recommended in your situation. So will that be convenient for you, Anugraha?
Yes, definitely, nurse.
Alright, so do you have any other concern now?
I have one more question to ask you. Is there a chance for surgery in the future in my case?
Alright, I understood your question, but I would love to tell you that I'm not the authorized person to go with the question. Since you're going to have an appointment with your doctor is the right person to have a conversation on that note. So you can definitely have a conversation with your doctor and get your doubts clarified there. Will that be okay, Anugraha?
Yes, definitely, nurse. I will ask the doctor about that.
Alright, so before proceeding further, I would love to know more about your habits, like especially when you're going out. So do you use any kind of sunscreens or hats, etc. when you go out in the sun?
Yes, I'm always using a sunscreen which is of higher factor like 30 and higher, and I'm also using hats whenever I'm going outside. But nurse, I feel that it is not of use now because the damage is already done.
Alright, I highly appreciate that you are still using sunscreens and you're covering up yourself when you're going out, but I would love to make a small correction in your thought process that it's always important for you to continue with the same routine that you're following so far, because in order to prevent the further damage, it's important for you to apply any kind of sunscreens or moisturizers when you go out and to cover yourself up to protect from the sun.
Sure, nurse, I will keep that in mind.
I'm glad that you're understanding everything properly. Since you are here for the stitch removal, I would love to ask you about your wound site as well. Will that be okay for you?
Sure, nurse.
So do you feel any pain?
None.
Is there any kind of discharge that is coming out of the wound site?
No, I haven't noticed any discharge from the wound site. But nurse, I feel that it is too early to remove the stitches.
Alright, your concern is very much reasonable, I would say, but as per the doctor's assessment, it is the right time to have a stitch removal in your case because your wound is healing well. And these kind of scenarios, we will be removing the stitches after 7 to 14 days.
Okay, nurse.
So is that convenient for you?
Yes.
Alright, so Anugraha, at the same time, it is very much important for you to keep your wound clean, dry and covered even after the stitch removal to make a speedy recovery. Will that be convenient for you?
Yes, definitely, nurse. I will keep my wound clean and dry.
So do you have any other concerns on this note?
No, nurse, I have no other questions.
So are you ready for the stitch removal then?
Yes.
Alright, so I'll go and make the arrangement for your stitch removal. So I'll be coming back after a couple of minutes, and thank you so much for your patient listening and understanding, Anugraha, and I wish you a speedy recovery.
Thank you, nurse.
You're always welcome.